He sent me a text message at 6:44, and it said, "I love you."
A final text. Jasmine Smith saved the screenshots from her fiancé from March of 2020. He was in Detroit. She was here. He got sick. It was COVID. She was unable to reach him, desperate for answers, calling hospitals, and eventually found him.
When he went to the hospital in Detroit, they didn't have any rooms for him. They said that he should be in ICU. They didn't have any beds. They were literally just waiting for people to die.
Sadly, Thomas Fields Jr. is one of more than 640,000 Americans who have lost their lives to COVID.
He never woke up, never opened his eyes.
The CDC reports that minorities have suffered a disproportionate burden of COVID-19 deaths. One study of selected states and cities showed that 34% of deaths were among non-Hispanic Black people, though this group accounts for only 12% of the total U.S. population. News 3 Investigates looked into death rates in Virginia statewide. The health department reports that 2,961 Black people have died of COVID. That's about 25% of the total amount of deaths. But the Black population in Virginia is about 20%, according to the U.S. Census.
Unfortunately, this is something that we've been seeing.
Dr. M. Norman Oliver is the state health commissioner. He says Black and brown people, along with the rural communities across the state, have been hit hard by COVID.
These communities, I think, are all communities that have systemic discrimination basically against them.
News 3 compared death rates to population rates. In Norfolk, 288 people died of COVID. 181 were Black and 92 were white, according to the health department. Black people make up about 63% of deaths, while whites make up 32% of deaths. But the population in Norfolk is 47% white and 41% Black. Higher COVID death rates compared to population for African Americans were also found in Chesapeake, Virginia Beach, Portsmouth, and Hampton.
It's disturbing to see such wide spread kinds of inequities across racial categories.
He says there's several reasons, like minority groups being disproportionately affected by chronic medical conditions, having less access to health care, and being more likely to work as essential employees.
And then the number of uninsured in those populations is much higher than it is elsewhere. And they have less ability to get the kind of medical care that they need.
And providing medical care to the uninsured is why Golden Bethune-Hill founded the community-free clinic of Newport News.
I talk with people every chance I get about the virus.
Even her own employees.
Yes, I have been talking with my son about taking the vaccine, how important it is to take it. And it's just really been a real struggle for him.
The hospitals are filling up, and when they get sick and they say they wish they had taken it, there's nowhere for them to go. Tell him to talk with his doctor.
I will.
But because of systematic racism and health disparities, that puts a lot of doubt in people's minds because we've always had to fight.
President of the Celebrate Healthcare and Advocacy Group, Gayleen Knoyton, has been fighting to get as many people vaccinated as possible by holding events.
We have never, ever, I don't think, experienced anything to this level before.
She, like many others, are disturbed by the number of minorities dying from COVID.
And we want to do something about it.
The health department says they've worked to increase vaccination and testing efforts in minority and rural communities.
We want to make sure that we are vaccinating them at least at the same rate that we're doing the white population.
An AP poll found that Black and Hispanic Americans are about twice as likely as white Americans to say that they have a close friend or relative who died of COVID-19. People like Jasmine, who lost her love, a veteran, chef, and a man who worked to help others.
I believe that he really did save a lot of people's lives, and he allowed a light to be shined on not just this issue, but a deeper issue in our community about sharing information and trusting systems.
Getting people vaccinated, speaking about the issues, and learning to navigate through the pandemic one day at a time. Margaret Kavanaugh, News 3.